Hello everyone, this is the explanatory lecture for eco-breathing. In this session, we will solve problems number 56 to 60. Looking at problem number 56, it explains that the left ventricle is being imaged using a contrast agent. It is asking which contrast agent is not used in this process. If you look at the options below, several contrast agents are described, but you only need to distinguish between two of them. There is a contrast agent that can only image the right side of the heart. And there is a contrast agent that passes through the lungs and then images the left side of the heart. So for the right side, you can think of it as being related to the keyword saline. For the left side of the heart, you can think of it as being related to the term microbubbles. So even if you don't know the details, since the question here is about imaging the left side of the heart, you can disregard the options related to saline, which is used for the right side of the heart. The remaining options, such as B, C, and D, are contrast agents that use microbubbles. For reference, you just need to familiarize yourself with the names through this question. The important point is to clearly understand the difference between the contrast agents used for the right and left sides. Let's move on and look at the next question. Looking at the question, it describes a contrast study of the left heart, where swirling is observed near the apex of the heart. This question asks which aspects the sonographer should adjust to control these phenomena. First, let's check which part this refers to by looking at the diagram. If you look at the image, you can see the area where the contrast agent has entered near the apex of the heart, and there are darker areas that appear as if they're swirling. Since this is a still image, it's not very clear, but if you watch the video, you'll see these swirling, moving patterns in the footage. These kinds of swirling illusions are referred to as swirling artifacts. To improve these areas, if you adjust a few parameters, you can see that the image becomes much clearer like this. In this question, you are being asked which aspects you should adjust to achieve this change from the current state. I will explain the three main examples. The first is to reduce the MI value on the equipment. This MI value stands for mechanical index, and it must be set lower than the default value to prevent the microbubbles used as a contrast agent from being destroyed. If the MI value is set too high, the microbubbles are destroyed, and the areas where they are destroyed appear dark, resulting in such changes. So, in order to achieve good overall contrast, the first thing is to lower the MI value. The second method is to increase the injection speed of the contrast agent. If the injection speed of the contrast agent is too slow, it may not be evenly distributed. So, increasing the injection speed of the contrast agent is the second point. Third, it is necessary to check whether the focus has been properly achieved. If the focus occurs in an area different from the one we want to observe, we won't be able to obtain proper images. Adjusting the focus to match the area we want to observe is also a factor that can help improve the swirling artifact present here. Among these, the most important thing is adjusting the MI value. You should pay particular attention to this part. If you look at the content again based on what we've discussed, it mentions adjusting the transmission gain in this section. The wording here is a bit complicated. Simply put, you can interpret it as reducing the MI value. Usually it won't appear like this on the exam. Usually it will say to reduce the mechanical index, so you can remember it this way. So the correct answer is to choose option A. If you look at option B, it says to slow down the injection rate of the contrast agent, which is incorrect. In fact, it should be injected a bit faster to ensure overall enhancement. Options C and D are unrelated. Let's select option A as the correct answer and move on. Now let's look at question number 58. This question is asking about a technique related to reducing venous return. Since it's a simple topic, let's find the answer right away. The correct answer is option D. When the Valsalva maneuver is used, it can temporarily reduce venous return. The other options from A to C are actually related to increasing venous return. Now let's look at question number 59. Similarly, this question is also asking about maneuvers. You need to choose the option that is associated with temporarily lowering blood pressure and causing tachycardia. The correct answer is option A. As you can see, inhaling amyl nitrite causes vasodilation. Due to vasodilation, venous return decreases, and as a compensatory mechanism, the heart rate increases. Because the veins decrease as the blood vessels dilate, blood pressure can temporarily drop as well. So the correct answer related to this is option A. Now, let's look at question number 60. Hypertrophic obstructive cardiomyopathy, So the question is asking about medications that can be used when there is hypertrophic obstructive cardiomyopathy. The most representative medication in this case would be beta blockers. Beta blockers in this case are related to stimulating the parasympathetic nervous system to reduce heart rate. When the myocardium becomes hypertrophied, the heart beats excessively fast and pumps out blood too quickly, so beta blockers are used to control and reduce these effects. The representative beta blockers are listed in the material from Avon. Just remember the names of the drugs along with the key points. Epinephrine and dopamine, on the other hand, are drugs that actually increase heart rate, so they are unrelated options. As for Lasix, it is generally used in cases of dilated cardiomyopathy rather than hypertrophic cardiomyopathy. In the case of dilated cardiomyopathy, the heart is expanded like this and filled with blood inside. In this state, since the heart is filled with blood, you can consider it a condition where the preload is increased. In such cases, diuretics can be used to lower this preload. However, in hypertrophic cardiomyopathy, beta blockers are mainly used. Please keep that in mind. Additionally, to explain further, when treating hypertrophic cardiomyopathy, one option is to surgically remove the thickened part. Alternatively, alcohol can be injected into this area to reduce the movement of the tissue. Alternatively, an implantable defibrillator can also be used to regulate the heart's rhythm. Since the question asked about medication, you should consider Avon as the correct answer. For your reference, hypertrophic cardiomyopathy can be treated through various surgical techniques. Please make sure to review this information as well. With this, we've solved up to question 60. For the remaining content, please continue to refer to the explanatory lecture on echo breathing provided later. Alright, this concludes the lecture. Thank you.